Welcome to this explainer. If you're gearing up for the MRCPCH clinical exam, you already know the communication station can feel, well, a bit like walking a tightrope. Today, we're going to completely master one of the most high-stress scenarios you're going to face, explaining supraventricular tachycardia, or SVT, and Wolff-Parkinson-White syndrome, WPW, to a highly distressed parent. By the end of this explainer, you'll know exactly how to structure your consultation, draw the right diagrams, and use simple analogies to turn a really tense situation into a massive success. Let's dive right in.
So here's the core challenge. How do you explain a shivering heart to a completely terrified parent? Look, the examiner isn't just testing your clinical facts here. They're actively testing your ability to transform a high-stress medical emergency into a clear, empathetic conversation. You're walking into a room where a parent has just watched their kid go through a terrifying event. The science matters, for sure, but your empathy and clarity, that is what's actually going to get you a pass.
Okay, here's the game plan. We'll quickly cover the exam scenario, break down the IRCAP framework, show you how to draw SVT and WPW, introduce the shivering heart analogy, map out the management plans, and finally, nail that perfect close.
Section 1. The exam scenario. Let's set the stage for what you're walking into.
Imagine you're standing outside the door. You've got exactly 3 minutes to read the prompt. It tells you you're in an ER side room. A 2-year-old child, let's call her Soha, came in with severe tachycardia, and the ECG shows SVT. But here is the catch. Her mother, Mrs. Fatima, is absolutely furious because the medical team just immersed her toddler's face in cold water. Now, to any parent, that looks horrifying. Your job is to address her anger, explain the condition, and manage the whole situation. So on your blank paper right now, you need to jot down those names, ages, and your specific task.
Section 2. The IRCAP exam framework. Before we even think about medical jargon, we need a rock-solid structure.
This is literally where candidates throw away easy marks. The IRCAP framework is your safety net. First, introduce and build rapport. Say something like, "Good morning, I'm Dr. X. I believe I'm talking to Mrs. Fatima, Soha's mom." Acknowledge she's had a really rough day. Second, clarify your role. You're there to discuss Soha's health. Third, and do not skip this, ask about an attender. It's a tough situation, so ask if she wants someone else present before you start. Skip it, and you'll definitely lose marks. Finally, check prior knowledge. Ask, "Could you tell me what you understand about Soha's health so far?" You absolutely have to know her starting point before you launch into your explanation.
Now, when she brings up that cold water immersion, you cannot get defensive. You have to lean into empathy. Try using this exact phrasing. "I know it was incredibly hard for you, Mrs. Fatima. I am so sorry no one explained what was happening. It's actually a specific treatment we use to safely slow the heart rate down." See what we did there? You validate her fear while smoothly dropping in the medical rationale.
Section 3. Drawing SVT and WPW. This is the visual core of your consultation.
During those 3 minutes outside, prep your drawing. Sketch 2 simple hearts side by side, one normal, one abnormal. For the normal heart, draw the SA node, an arrow to the AV node, and down to the ventricles. Tell the parent the SA node is like the maestro of the heart, setting a normal, steady rhythm. Then point to your abnormal heart. Draw an extra ectopic focus, giving out chaotic extra orders. Explain that in her daughter's case, this extra spot is shouting too many commands, causing the heart to race completely out of control.
Now, what if the prompt specifically mentions a delta wave on the ECG? If the examiner gives you that, you're dealing with Wolff-Parkinson-White syndrome, or WPW. The explanation is basically the same, but you'll clarify that there's an actual accessory pathway, an extra physical route outside the atrium, causing the racing. Whether it's standard SVT or WPW, the visual of the steady maestro versus the chaotic extra pathway works like an absolute charm.
Section 4. The shivering heart analogy. Here's where we bring that drawing to life. Don't just sit there pointing at paper. Get a little kinesthetic. Hold your hand up in front of the role player like you're gripping a ball. Tell her normally the heart pumps with a strong, steady squeeze. But with these extra orders, and here start shaking your fingers really fast, tell her the heart is shivering. It's just shaking, not pumping effectively. Because it's shivering, the blood isn't reaching the rest of the body. This is a total light bulb moment. It perfectly explains to the mom why her child got dizzy, drowsy, couldn't feed, and even threw up. You just connected an invisible electrical problem to the terrifying physical symptoms she actually saw.
Section 5. Management and emergency plans. Once she understands the why, you have to pivot straight to what's next.
She's going to be terrified this will happen again at home, so you must give her clear safety netting. Tell her if she ever notices blue lips, severe dizziness, fainting, or that extreme heart racing again, she needs to call an ambulance right away. And crucially, tell her she'll get an ER access card. This is huge for reassurance. It means if she comes back to the hospital, she skips the triage line and comes straight through to the doctors.
Next up, the treatment plan. First, reassure her SOHA is stable right now, thanks to the meds given through the IV. Looking ahead, mention that the heart doctor, actually try to avoid the word cardiologist, just say heart doctor, might prescribe some heart-slowing medications to take at home, like beta blockers or amiodarone. If it's WPW, gently mention avoiding caffeine when the child gets older. Finally, explain that if it keeps happening, the heart doctor can do a procedure using a tiny wire or catheter to just carefully destroy that extra pathway. Oh, and let her know you'll do a jelly scan, an ultrasound of the heart, just to confirm the structure itself is perfectly healthy.
Let's talk pacing. You've got a 9-minute station, 3 minutes prep outside, then you spend about 6 minutes doing your IRCAP, the drawing, the shivering heart analogy, and outlining treatments. But the moment that bell rings with 3 minutes left, it is time to transition. You have to summarize and do your safety netting.
Section 6, Empathy and the Perfect Close. A strong start earns points, but a perfect close guarantees you the pass.
When that 3-minute warning bell goes off, do not panic. Take a breath, use a calm voice, and just say, I know I've given you so much information today, let me just quickly recap what we talked about. Boom! You're showing the examiner you are organized, considerate, and completely in control of the consultation.
Here is your final checklist. Run through the name of the condition again, SVT or WPW. If she's panicked and asks if her child will die, validate that fear heavily, but firmly reassure her this is highly controllable. Tell her you're going to connect her with a support group of other parents dealing with the exact same thing. Offer trusted leaflets and websites. And the absolute most important note to end on, reassure her that with the right care, her child is going to live a healthy, happy, near-normal life.
By sticking to the IRCAP framework, using clear drawings, acting out that shivering heart, and laying out a rock-solid emergency plan, you are going to absolutely crush this communication station. It kind of makes you wonder, right? If you can demystify a shivering heart this easily, what other complex diagnoses can you break down for your patients? Thanks for joining me for this explainer, and seriously, best of luck on your exams. You've got this.